Welcome, everybody, to the Kona Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I got a great one today. I am here with my friend Tabitha Kucera, and we are talking about the art of animal handling. Tabitha has strong opinions about where we are with animal handling as a profession, and honestly, she's not impressed. And she makes a good case for why she's not impressed and how we can do better and where we can go. And guys, I really enjoyed this. There's a lot of behavior in here. There's a lot of sort of practice management in here. There's a lot of professional development and sort of future of training in vet medicine in here. So it's a beautiful, it's a healthy salad with lots of stuff in it that if you really love salads, it's a healthy salad. If not, it's a pizza with really great toppings. That's what it is. Anyway, it is a awesome conversation. One thing I will say real quick, Tabitha talks a lot about FAS and FAF scores. But we don't define the term. If you're not familiar with FAS, that's fear, anxiety, and stress. So if you're talking about an FAS score or a high FAS score, that means high levels of fear, anxiety, and or stress. And so anyway, I just wanted to define that term at the very beginning. Guys, this is a fun episode. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast. Tabitha Kucera, thanks for being here, my friend.
I am so stoked to be here. I always love catching up with you.
You are one of those people who just makes me light up. When you're around, like you make me smile, and I just feel this energy just from your presence. But you are such a positive person, and you are such a force of good. And so for those who don't know you, you are a RVT, a VTS behavior, a CCBC, a KPA CTP, and an EIEIO. I think. So you're a registered vet tech. You are a specialty vet tech in behavior. You're a certified cat behavior consultant. You are a KPA CTP. What is that again?
That's Karen Pryor Academy Certified Training Partner. All these letters get confusing.
So much.
Yeah.
So what I want people to take away from that is cats, behavior, training partner. Those are the big things. You can do it all. There don't have to be cats involved. You do a lot of behavior. You and I have met earlier this year, really. Yeah. But I saw you speak at Western Vet Conference, and you're amazing, and you packed the room, and you're super fun. And so anyway, I wanted to bring you on. I want to talk to you a little bit about your own business. So you are the force behind Chirrups and Chatter. It is the company that you have that does sort of behavioral consultations. But the part that I'm really interested in is your organizational consultations. And so you do a lot of work, specifically, usually around animal handling is my understanding, but you work with groups at shelters and in vet clinics and things like that. And so I wanted you to sort of give me an honest view of the state of animal handling in vet medicine, because I think that animal handling is one of those things where people are like, I totally do that. Yeah, we're great on that. Check that box, move on. What else you got? And I'm not convinced that everybody in vet medicine has really got animal handling where it needs to be. I think it's one of those essential pieces that is maybe not sexy, or that people think is like it's too fundamental for them. I don't know that that's true. Tell me if I'm right or wrong here.
You're right. It's the sexiest thing ever. So it gets me excited. Let's get weird. So handling is something that there has been progress, which I like to focus on the positive, but big picture, there's a pretty severe problem in animal welfare, but also vet med, where handling is not treated as a skill. So it's not even treated as it's a basic skill. So let alone advanced handling is not a real thing I hear about very often.
So I felt like there was a real surge forward around Sophia Yin and then Fear Free. And there was a big push. And it was pre-pandemic, probably 2015, 2012, somewhere in there. And I felt like there was a big push, and there was a lot of talk about that. And then Fear Free was kind of getting up and going, and there was sort of a big push there. But then I do feel like that has sort of died down a bit. And so that sort of tracks for me. I'm curious if that sort of timeline works for you. And then talk to me a little bit more about where you see animal handling going when it's done really well. And so I think that you're right in that we treat animal handling as a basic skill. It's actually probably an art form, right? There are some people who are truly masterful at this, but I don't think that they get the accolades, or I don't know that we have a name or a label for them. So how does that sound with you? Are you on board with that idea?
I wasn't planning on becoming this handling guru, but actually what got me into behavior a very long time ago, as a technician was I met Sophia again. Thankfully, I had the chance to interact and work with her a bit before she passed, and she changed my life. I mean, I would not be who I was today without her. I could genuinely, and I got to meet her mom and tell her that, which means a lot to me. Oh. But that was when my mind was blown. And I was like, we all want to do the best for our patients. And that's where it started. And then I got really into body language and handling. And then that led, which, because it is all behavior, but that led me down this behavior life that I have now. And it's not even that. I just don't think we treat it as a skill at all. It's probably the biggest part of our job, from interacting with animals, from a safety standpoint, from a managing pain and stress. I mean, it's literally everything. And what I was taught, so I only speak for myself. Yeah. Now, to be fair, is that experience very similar for other people? Yes. But for me, what I was taught as a technician and what a lot of people are still taught are things I haven't done in over 12 years. So something I say that's a really powerful statement that resonates with me, even though I say it all the time, was we are still taught the handling techniques that we were taught when we didn't think animals felt pain.
Yeah.
That is for real. That is where we are at. So I don't think, to be fair, to be kind to ourselves, we are not set up for success. We are set up to fail as handlers because we are given no skills. I wouldn't call what we are taught skill. I would just call force. It's not really a technique. It's
how you grab them.
Right. And then when they move, you grab them harder, even though they're alive. And like, it's pretty normal for a leg to shift. And then we're like, it was the poke. Nope. I'm going to be honest, everybody. It was you restraining. I don't even call it restraint because I'm a big language person.
Okay.
But restraint tracks with what I was taught. Force. When you think of restraint, you think of 1920s mental health care. I call it handling. Because that's what it is. But I have very strong feelings.
No, I like this. Give me a walkthrough just so people kind of know what we're talking about here. When you say, hey, there's these things that we were taught, and there are these things that are commonly taught that I haven't done in 12 years. What are some of the things that you see still being taught that you're like, I don't do that, or I wouldn't do that?
The biggest thing is none of us are taught body language.
Okay.
We're taught red, which I wouldn't say taught. We're more taught on the job. Like, that dog is barking and lunging and has piloerection along their back. They are in the red. We weren't taught to recognize all those green, yellow signs. So of course, this animal did not become aggressive out of nowhere or exhibit aggressive behavior, because I don't like that as a label. We should be describing behavior.
Yeah.
But if you don't know what green, yellow, orange looks like, how are you going to prevent or change up what you're doing to prevent red? So I think the biggest thing is just foundations. We aren't taught how to read our patients, which from a pain lots of standpoints is problematic. But then also, I was just taught to, again, not assess, approach, immediately approach. And then with the dog, it's the whole like hand around the neck, hand around the lower abdomen, having their face. I was taught to put their face right next to my face.
Right, like in the crook of your neck.
Like, what the heck are we thinking? And then again, like I said, even though like they're alive and it's very normal for them to move. I'm not saying move like 5-10 steps forward, but if you held me in place, I am going to react and escalate severely, not even a little.
Right. Okay.
So I was taught to hold the dog really close to start, no other technique. And if they move, hold them tighter.
Okay.
And with cats, I was taught to, again, not assess body language at all, immediately interact with them and put them in an uncomfortable position from the start. I don't know why we flip cats. Dogs in some cases too. Like lateral recumbency is needed in, I'm going to be honest, very rare situations. And I was taught to essentially put every animal in an uncomfortable position to start. So like, it would be like me getting my blood drawn and my nurse being like, I need you to do a backflip and stand on your head. Why are you stressed?
Like they start with a leg sweep.
Yeah.
You're down.
Yeah. A leg sweep. Exactly. Like their weight isn't supported. And then again, the scruff thing and then to stretch them, which I still get emotional because I know, not even from a behavior consultant standpoint, because the amount I see in my cases is whoa, but I'm aware of how many cats have pain, especially in their coxofemoral joint and and I was taught it hurts my heart, but to stretch the hell out of these animals.
Yeah.
So those are again, it wasn't technique, it was force. And then when they move, you do it again. And then we kind of have learned helplessness as professionals because we're like, we just keep doing the same thing over and over again. And that's hard for us because we aren't set up for success. But it's a big picture. Like, again, we're taught force or restraint and really no critical thinking. Like, I approach handling like I approach anything in medicine or behavior. I approach it from a critical thinking standpoint.
Yeah.
No one size fits all approach.
So I want to jump back here for a second. So you talked about reading, body language as sort of a foundational pillar. Let's say that you and I are in practice together, right? And we have a new person who's going to join the team. And this person they're a vet assistant / possible front desk person, not sure, but they've never worked at a vet clinic before or anything. And I look at you and I say, Tabitha, how are we going to train this person? Not getting too far down into the weeds, but a high level. What are the foundational pieces that you feel like someone coming into the vet profession should have in order to be proficient in animal handling? How do we get someone from blank slate, perfect scenario, no bad habits to overcome? How do we get them from blank slate to functional animal handler assistant that makes Tabitha smile?
Actually, I'll be honest, I think that's easier.
Yeah.
Oh, yeah. Sometimes.
Let's start on a low. Let's keep the bar low.
I love it. I love it.
Yeah.
So one, I'm a big, and for all of you amazing, because I know there's a lot of us out there making positive changes and you could feel alone. Because I hear this feedback a lot, but also I've been that person at a lot of places. You are showing through doing, no matter, even if the rest of your staff is not. You are doing the best for your patients and the best for you. And that is so important. And people are seeing it, whether they're being whatever their feelings are, they see that. So I think a big part of it is I would start having that assistant work with someone that, again, many clinics, I'm going to be honest, don't even have an advanced handler because it's not treated as a skill. But I would identify the advanced handlers because we all have our different skill sets. That's why vet teams are great. And then I would have them shadow with that handler for a week or so, and then have them handle mostly FAS 0 to 2 patients and possibly have them practice on some stuffed animals because I'm a huge fan of that. I'll do like a lunch and learn or onboarding. Some of the clinics I worked with we've created, I love onboarding and a lot of clinics don't do this. I love a book, but it's the same book for 10 years. When I read it, I'm like, whoa, you have not updated this in a significantly long time. And this is not how people learn, most people. So I'm a big fan of like, hey, we're going to practice this handling technique on this stuffed dog or stuffed cat for 5 minutes every day or whatever. And then the shadowing thing and starting them with FAS 0 to 2 patients. Okay. Just that is pretty powerful because you're creating an environment that's conducive to learning, which is not common, unfortunately. You're creating an environment where that person feels comfortable not knowing everything because no one does, and we shouldn't be punished for that. And then where they can ask questions and feel supported and not judged or stupid. Yeah. And I'll be honest, like sometimes I just do a 90-minute lecture on handling and I'll go to a conference and they're like, and this is not me being cocky, it blows my mind. I do have mostly just videos in my lecture, so it's very visual. But they'll come up to me and say, I saw your lecture 5 years ago. It changed my life. This is how I handle animals. So I think sometimes we don't realize how well people can take in information because it's even surprised me. I'm like, you saw me lecture once or twice for 60 to 90 minutes. It wasn't even a hands-on workshop. And the amount of people who are like DMing me and emailing me videos of like, we just tried this. Because I also say start small. Like, hey, this is a skill set. This is not going to happen in 5 seconds. Like, when I'm at a conference, I always ask a vet, how long was your first spay? How long is it now? Yeah, that's because so all of the handling is not going to look like mine because it is a skill, but it blows my mind. Like they just were supported and I am welcoming and kind, but all I was supportive and taught them for 60 minutes at a lecture or two. And they are applying these practical techniques within a day. Yeah. So sometimes I think we downplay things. Now, unlearning things, definitely, of course, no matter what career we're doing, that is more challenging. But then I also think showing through doing this onboarding, having someone who's an advanced handler outside of your practice. Because my sister's awesome. I have a bunch of letters by my name. She still doesn't listen to me. So
Yeah.
it's not that like your colleagues don't love you, but there is something about that. There's probably some psychology term that says what that is.
Well, I mean, one of my favorite sayings is you're only an expert 50 miles from home.
Yeah. Oh, I like that. I'm stealing that.
It's so true. It's like I try to tell my kids stuff, and I'm like, people pay good money to hear what I have to say, and my kids are like, we're not paying you good money.
And
to
then
hear
it's
anything.
also really interesting because I talk about handling high FAS patients, which there are very limited resources on this, which is why I have created so many. But it's really interesting because let's say you have some anesthetic complications, which unfortunately, this is part of our job. We need to talk about it, learn from it. Things happen, lots of things. There's only so much of things in our control. So let's say you have that. You're going to look at your anesthetic protocols.
Yeah.
But I'll be honest, in my 15 years, my 15 years of practice, because I've actually collected data at practices, which is something I recommend other people do. But when there are scratches, injuries, not just bites and scratches, like back injuries, instead of taking that in as data and being like, I need to help educate and empower my staff to learn more handling techniques, not even use handling tools, because that's a whole separate lecture because I have like 5 and a lot of the things that are sold out there are very problematic. But no one looks at that. They're just like, the dog was being a fill in the blank with the label.
Yeah.
Instead of being like, hey, this is data. None of us are good at everything. Just like anesthetic complications happen. If you have, because I work at some places, which again, they're amazing because they're reaching out for help. But the biggest reason is because they've had 10 bites.
Yeah.
In 1 month. And, it would be great if we would be more proactive than that. But again, I love that even in that case, they are like, hey, we need help with this. Because I'll be honest, as a fields, for some reason, we don't take that in as data. We just say it's the cat or dog, which is really interesting to me. I'm not sure why, because when it comes to everything else, which I love about our fields, we would look at our protocols and like adapt and change.
So you sort of said, boy, you look around and most of us are still doing this the same way. Why do you think there hasn't been more advancement in general animal handling?
So it's one of those funny things that I'm learning as I get older. I can't explain everything, can't understand everything. I try to, because I get a lot of contacts because I'm in the field and I work with tons of people and tons of environments. The biggest thing is, I think, as the starting foundation in animal welfare and vet med is handling is not treated as a skill. So yeah. I remember this one time I was doing one of those really big events where we do low cost vaccines and exams to hundreds of cats and dogs in like an 8-hour period. And my partner was there, who is not in vet med. Mm-hmm. And this was a long time ago. So I wasn't even as advanced and skilled as I am now because we're always growing. And I remember some like volunteer supervisor person handed him a leash, and it was a 80 to 90 pound dog. They were exhibiting fear and stress. They were tense throughout, ears were back, lunging, barking. I mean, there was so much stimuli. Thankfully, even back then I was like, let's put him behind a tree. Let's minimize. But my partner, I'm so proud of him. Even back, he's like, I'm not comfortable handling this dog. And he got screamed at by the supervisor, but he is not. He's an adult, and I know this is this crazy concept. We can communicate in a professional way. Yeah, and he's taught me so much about that. I know that, not as in like, don't let people treat me that way. Not as in I'm not professional. But I remember, and then that, I was like, I'm so proud of him. And the fact that the supervisors like started screaming at him, that's, I feel like, unfortunately, that's most people's experiences, which is really, so we're putting humans at risk, animals at risk. And we're not, if all your team doesn't feel safe, then we're also understandably not empowering or educate. We're setting up our staff to fail, but also have injuries, not get thorough exams. I can sell this, however, because
well, I was just curious about what you say. I mean, to me, I think that there's this inherent trade-off, right, in life of what is the fastest, most convenient thing right now. And we tend to discount what does that path do for us in the long term. And so I think a lot of times what's fastest today is going to be longest and hardest and most painful in the long term. And so I think a lot of times when you say aggressive restraint, let's grab that dog, let's, headlock on the dog and scruffing on the cat. If you're trying to get something done right now today and getting done with the thing is the metric of success, I go, I get it. If you zoom out and look at the lifespan of the pet, you say, well, you may have gotten done fast today, but this is a cat that's going to become more and more reactive, in the future. And every time it comes in, it's going to be more difficult and stressful. And the probability of being bitten or, having an incident is going to continue to go up. And so, yeah, maybe right now today, you can make a case for doing this if the metric you're looking at is speed getting done today. I wonder if there's a way to sort of shift how we judge success, right? So I think it's got to be a combination of efficiency, right? We can't wait until the animal falls asleep on its own and then sneak in there.
But it's interesting though. I think, so because as you're probably similar to me, Andy, where we have the pleasure of educating and meeting tons of different people. Mm-hmm. And I love feedback. And sometimes back as, when I first started lecturing, I would hear some of the same things. So now I've incorporated it into my thing. And that's actually a really common myth that I hear, that it takes longer because now I'm skilled. Just like that first spay, you weren't as skilled. So yes. To be fair, I'll be honest, I have a weird thing that I do where I work with such high FAS patients who cannot be handled, most likely due, in many cases, I'm going to be honest, to the severe trauma of, I have to be frank, the forceful mishandling of these animals. And no one, they either been fired from their veterinary clinic because, again, you sit on this dog. There's no reason to ever. There's some nevers, okay? There's never a reason to sit on a dog, ever. There's not a lot of nevers, but that's one. And the clients, or in some cases, they're amazing new veterinarians, work with me, whether it's out of state or in person, and we create handling plans together. And this dog can then say, like, a sedation takes 90 seconds. So I can handle animals, like the amount of animals that these awesome colleagues of mine spent 20 minutes trying to get a blood draw. I did it in 1 to 2 minutes. So, but I'm also utilizing advanced handling techniques. And if I had to like summarize quickly foundations, I would say communication, planning, considerate approach, using a touch gradient. So I call it supportive handling.
Yeah.
And then safety and management, which may be using a basket muzzle. But do we know how to, like in my high FAS handling workshops, I'll be honest, until I got in behavior, I did not have access to basket muzzles. We were still using nylon. So I'm like, no wonder this poor colleague of mine has never even used a basket muzzle. And then we're like, super high FAS dog, go. That's not how to teach people. That's not great.
Oh, man. Let me ask you a potentially controversial question here real quick.
Ooh.
Yeah. Would you, Tabitha, be excited about the idea of a veterinary technician specialty in animal handling? Or do you think that stays under behavior? And do you think that people recognize that animal handling is part of behavior?
I would love that. But I'll just be honest, like, I don't think people, and that's the other thing. I get people really stoked about handling.
Oh, it's a gift you have. You're so passionate
but
about
it's
this.
so sexy, Andy. It's like the sexiest thing ever because we're doing the best for our patients. And that's the other thing I say all the time. Because again, most of my patient load is high FAS patients.
Yeah.
So there are always steps, always, capital always, to manage, prevent, or decrease fear, anxiety, and pain. Always. And that's something, because that's another common myth I hear. Oh, but it's an FAS 5 dog, or I'm an ER. I'm like, it's even more important that you have skills, actually, in those cases. So again, it's interesting, some of these like foundational truths that are incorrect in our field. So I think, but that's with anything. I mean, with anesthesia, with practice management, I'm sure you have tons of those that you've experienced and have been working to break. So I think there's just, and there aren't a lot of, I mean, I'll be honest, there aren't a lot of advanced, because I call it practical. I am actually doing a course on it right now called Practical Cooperative Care, or collaborative care, where there are always steps to minimize, decrease, or manage fear, anxiety, and stress. And I think sometimes people don't realize that. And then I have shelter and vet staff reach out to me all the time. Like, do you have resources? I'm like, I'm going to be honest. No, which is why I created a bunch for high FAS and that critical thinking approach of like, what is a handling plan? Because I don't think many of us, I never use those. I used to not even communicate, not because I didn't love the vets I worked with, but we would just go in a room and not talk about who's doing what order are we doing. It blows my mind. I'm like, no, what? Like now that I know more, I'm just like, whoa.
I think you made a really strong argument here. Like I said, I was playing around with the idea of, efficiency. Efficiency today is perhaps the driver of what we're doing. I think you shoot that down pretty well to say, look, increased communication, we can be more efficient. Like this is, I think you've convinced me that idea I had was wrong. I think what I would switch to now is to say, because you make a good analogy to practice management and things, and I go, well, you're right. I see a lot of things in practice management that make me shake my head. My justification for them usually is that people use the tools that they have been given.
Yeah.
And again, if no one shows them a better way, I don't think people are necessarily good at questioning, is there a better way? I mean, I think that's sort of a profound thought of, can this be done differently? And a lot of people just say, this is how I was shown to do it. This is the tools that I have. I'm going to use them. We're going to run out of time here, but let me bring this back around. I'm going to give you sort of a hard question based on sort of our conversation so far. Is to say, I have no doubt, Tabitha, that people see you lecture and they hear your passion and enthusiasm and they go, I get it. Animal handling, I see it now as an art form. I see it as something that can be elevated. I see a path for growth and develop for myself that I can be really excited about. And as you're talking about this and you're talking about FAS and you're talking about high FAS patients and you're talking about sedation and you're talking about reading body language, and then go, it also seems, first of all, it seems great because there's so much that could be done, but it also can very quickly seem overwhelming to someone who's had just very minimal training and they're hearing you. And how do you advise those people, Tabitha? If somebody is inspired by this and they're like, I want to grow here, but I don't necessarily have support. I have a practice that's done it, the old way. Let's say that you have your standard vet practice where we've kind of done it this way forever, and the practice is generally going to be supportive of your personal growth and development. Maybe they won't agree to throw in and change everything, but they'll let you get more knowledge and then maybe listen to what you have to say. How would you advise that person to start spending time? How can they sort of start their journey?
That's a great question. I'll be honest, it all comes down to body language. So I think, because knowledge is power, as corny as that seems, but especially as a tech, where it can be sometimes more challenging for my lovely colleagues to respect us.
Sure.
That's just a real problem. The more, and this goes for everything, the more educated and the more empowered you are. So I think body language is crucial, to be fair, with everything, but definitely handling, because people will see a video of mine, for example, and say, that animal's going to bite you. And again, I'm not judging. That's really good data because this cat's FAS 0. But I also understand why many people are uncomfortable with cats because they're taught something that escalates fear and stress. So I think, because again, everyone's like, I know body language. I'm like, no, you don't. I'm going to be honest. Everyone. And then they see me lecture and they're like, yep, I didn't know. Because I didn't know. To be honest, I didn't know.
Sure.
Right. So I think understanding body language really, really well is the foundation, because then you can adapt in the moment, even without maybe knowing some skill set. Because we do kind of learn on the job. Sometimes we learn some not great things. Like, again, we learn red through experience, but no green or yellow. So if you can recognize that yellow, even if you aren't aware of some of these more advanced skills, you by trial and error will adapt in a positive way. But also I really like it because I think, let's say you are working at a place where you're going above and beyond. This is your jam. So you might attend some of my lectures or workshops, or you might go to International Cat Care or Fear Free. We need more, but there's a few orgs that can help with that. Again, showing through doing, no matter what, you are making a difference and you're doing the best by your patients, and also keeping yourself safe because that matters. But also, I've been in tons of situations where people are like, they're fine with this, that F word. Woo. And to be fair, we all should respect each other and be able to communicate. But also, I'm not going to be like, hey, vet or other tech or assistant, this cat doesn't like this. Even though that is not the worst thing to say, but also that's not productive.
You have to say things in a way that get heard. And that's sort of how I put it. It's not that you're wrong, but we need to say it in a way that it's going to get heard and get heard in a productive way.
And then we could describe the body language. So it's not like I'm arguing, but you can't argue with me. Like, this cat was doing this, this, and this, and now they're doing this, this, and this. Yeah. So and then I'll be honest, like, I'm very kind of professional. I'm not saying, but in my head, I'm like, same thing with pain. Mm-hmm. I'm going to be honest. There's been many situations where I'm like, this animal post-op needs more pain control. Yeah. And I might not be listened to. And then I say, because that's why I'm so good at identifying chronic pain and see so much of it in my consults, because it's all body language. So instead of just saying this cat's painful or this dog, which is helpful and you should be communicating that, that's hard for that vet or that tech. They might just bypass that. But when you're describing and then that animal gets an additional pain med, and then you could say, see, now, blah, 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 blah. Mm-hmm. Like, you can't argue with me. Yeah. I'm right. So I think, because sometimes just saying, like, it's been hard for me, but I've recognized everyone has different motivations, just like my animal learners, and reducing fear and stress for human patients, human clients, and animals sometimes is not enough motivation, because there's a lot of these other myths, like it takes more time, it takes more money. I'm like, actually, it saves time, saves money, saves sedation and anesthesia dosages. Like, so I think that starting with just knowing body language, like, and always you're practicing every day. That's the great news, because you're working with animals every day. It's just, you need some tools to be able to identify, lip licking. They lip licked 5 times in 1 minute. And the ears went back when I approached. Yeah. And then when I touched, the ears went back forward. Like, you're literally, it's like you said, Andy, you put it perfectly. It's this beautiful art form. Like, I'm adapting to my animal as I hold them. And my humans too, because, if I have a new human learner, I may use some safety tools that I wouldn't utilize as a handler myself. But as you're a new handler, as long as you're using those tools appropriately, that makes you feel safer. Yeah. Like, it's why I tell all my clients, like, basket muzzles are like seatbelts, because let's say, and again, I'm just being honest, if I basket muzzle train dogs, because it's a lovely thing, and if my dog was to get injured severely, it's appropriate behavior for her to bite you. Mm-hmm. It's not, right. It's just normal. So if my caregiver's dogs are muzzled, I'm like, I straight up tell them, like, even though we're going to come up with ways to communicate with your vet team and advocate for your dog, or sometimes I even work with the vet team, this is automatically, this basket muzzle on your dog, they are less likely to use force on your dog, just subconsciously. Okay.
Tabitha, where can people follow you online? Where can they see what you're up to?
So you can follow me on TikTok at Behavior Vet Tech, and Facebook, Instagram, and Blue Sky at Chirrups and Chatter, and then chirrupsandchatter.com. I have tons of handling videos available, but then of course I do lectures and workshops, and I'm all over the place, because that's where I have lots more videos, because there's only so much context you can provide online, even though I share tons. So yeah, definitely. And thank you so much for having me on to talk about this.
Oh, it's always a pleasure, my friend. I love having you here. Tabitha, thanks for being here. Guys, thanks for tuning in, everybody. Take care of yourself, gang.
Bye, everybody.
And that's what I got. Guys, I hope you enjoyed it. Boy, I really like this episode a lot. I really like it. It was kind of a sprawling conversation, but it gave me a lot to think about. Tabitha is super fun, and she's always a joy to work with and collaborate with and to learn from. So anyway, guys, thanks for tuning in, everybody. Take care of yourselves, gang. I'll talk to you later. Bye.